Earlier today in Washington, D.C., NEA Chairman Jane Chu and Admiral Clark announced that the joint partnership between the NEA and the Department of Defense would be expanding the Military Healing Arts program to 5 additional locations. And I'm pleased today to be able to announce that JBER has been selected as one of those sites that will now offer creative art therapy to our service members, to our veterans, and to their families. In addition to JBER, Chairman Chu and Admiral Clark announced that Camp Pendleton, Camp Lejeune, Fort Hood, and the Madigan Army Center will also become part of that partnership. Now for some, they may think that the NEA and DoD is kind of an unusual or an unlikely alliance. But for those of you that are familiar with the Healing Arts program, you know that this collaboration is using an integrative model, healthcare model, to serve our service members by using art therapy. This initiative began back in 2011 at Walter Reed in Bethesda. It quickly grew to include other artistic disciplines such as art and music, as we saw in the video here. This program's approach is based on an integrated model where art therapy is incorporated into the service members' treatment. Art therapists work alongside other healthcare professionals, including physicians, nurses, psychologists, and others, to develop individual treatment plans to help those with traumatic brain injury and associated health conditions. Back in 2013, this partnership expanded to military patients at Fort Belvoir. And there the NEA conducted a pilot program where creative art therapists conducted visual art therapy, the mask making that we saw here, and some other activities with our wounded warriors diagnosed with mild TBI and psychological health conditions. And as part of this project, it's estimated that over 1,000 masks have been created by patients, and these masks have taken on their own significance and research in an effort to understand the military experience from a service member's own perspective. And what we've been able to determine from the programs at Walter Reed and Fort Belvoir is that this approach can dramatically help those who are seeking treatment. Surveys conducted amongst our service members rank art therapy as one of the top 4 treatment options offered to them, with 85% of patients having stated that this type of care contributed to their recovery process. One service member stated, "Out of my various treatment modalities, art therapy is by far the best at helping me to release and understand my emotion regarding the overall effects of my brain injury and the circumstances surrounding that injury." But this integrated approach that has proved successful in the clinical setting is just one aspect of the program. It's estimated that the number of service members needing post-traumatic stress or traumatic brain injury care is twice the amount that we receive, and I think we know that clearly to be the case here in Alaska. Even for those who do seek treatment, the challenges of getting them to stay in treatment and continued care requires some level of community engagement. The community programs that are designed as a part of this initiative help connect military populations with local art providers in the communities where they live. NEA has a unique capacity here to work with networks of state and local art agencies to develop strategies to make these connections. And while we know that there are certain barriers that we have to overcome to ensure that those who need the care receive it, we cannot lose sight of also doing what we can to broaden the access of popular programs that are proving beneficial to the treatment of our service members, our veterans, and their families. I mentioned that I had an opportunity some time ago to visit with Director Chu at the NEA, and she walked me through much of what we had learned from Walter Reed and Fort Belvoir. And she was coming to me as the chairman of the Interior Appropriations Committee as part of that subcommittee budget we have oversight of the NEA. And quite frankly, I had thought that our conversation about her budget would be very, very different than what she presented. She chose to spend in the hour, maybe a little less than an hour that we had together, she chose to spend about 80% of the time that we discussed focused on this program and how this cooperation, this collaboration could benefit so many with just really laying the groundwork that the NEA could lead. And so I committed to her at that time that this was a program that we needed to see expanded. It was good to have it at Walter Reed. It was important to have it at Fort Belvoir. But it needs to be expanded. So with today's announcement of the expansion of these additional sites, this is significant, and we were able to do it because we included $2.4 million for this initiative in the FY16 Interior Appropriations Bill in order to expand it to the additional locations. And well, I couldn't say, hey, you need to have JBER as part of this. We had a discussion about the need across the country. But when you think about our situation here at JBER, the support that you all provide to all Alaska service members, our Guard, our Reserve, our veteran population, you have the top TBI facility clinic here for USAF staff. And so if the NEA was looking for an energetic, involved, and supportive partner, you didn't need to look much further than where we are here at JBER. We have an incredibly strong and supportive and vibrant arts community that is active, that is eager to engage with our veterans to improve treatment outcomes and really to improve quality of life. And so I am most appreciative to Chairman Chu and to Admiral Clark for the decision that they have made to expand this program to JBER, as well as to the other facilities across the nations. And I truly would like to thank each of you in this room and those within your networks, because I know that moving forward, we will all embrace as an opportunity to do more, to do better by those who have served us so honorably, and working through innovative partnerships like we have here announced this morning. This takes us many steps ahead. So the video, again, gave expression to so much, but knowing that we can speak without using our words allows us to think more creatively towards healing, and that's what this approach will do. And I'm just pleased to be able to welcome this announcement with you today, and thank you for your dedication to those who serve us all. God bless.